pang topic ulit natin ngayon. Auditory diagnosis, sound of the person in the clinic. Yung pagdating ng pasyente natin, i-observe na natin. O kahit hindi pa siya dumadating, ma-observe na natin. Diagnosis of the sound of the person in the clinic. Auditory diagnosis is not limited to the sounds emanating from the client's body, such as their voice, cough, and respiration. All the sounds they create can have a diagnostic relevance. Imbalances affect the body's physiology, the way the body moves and reacts, and the way the person interacts with their environment. This means that different patterns of imbalance can, in certain circumstances, manifest as audible sound created by the person. One of the first things we hear is the client ringing the doorbell. Often, there is nothing to note. And at best, it is very tenuous sign. But when there is something to note, it can say a lot about certain people. The most obvious example of this is someone who has hit in their liver. The person is often extremely goal-oriented and impatient. They tend to press the doorbell repeatedly. They will often not wait very long before ringing the bell if you do not buzz them in immediately. Kaya po yan yung mga taong parang kulang ng pasensya. A person with liver and heart blood deficiency is more likely to wait longer before ringing again, as they do not want to be a bother to you. Ito naman yung pag nag-doorbell siya, hintayin niya. Hindi susunod-sunod na mag-doorbell. The time it takes for them to come from the street door to the clinic door can also have relevance if you have a stayer. Someone who is Qi deficient or Yang deficient will usually take longer than someone who has excess heat. This is, of course, a very small sign, and there may be another explanation. For example, if the person is talking on their phone, if you have a door that they knock on, the sound of their knock will be more revealing than an electric bell. Sometimes the knock can give an impression of the person. Again, this is extremely tenuous sign that must be seen in the context of all the other signs and symptoms. A person who is excess will tend to knock harder and more times than a person with a deficient condition. Yung pagnanak pa lang po pag grabe yung mag-knock, excess condition yan. Pero kailangan din po natin tingnan kasi baka yung kumakatok yung kasama niya, hindi naman yung pasyente. A shy person, for example, a person with heart and gallbladder Qi deficient will tend to be more hesitant and will not knock so many times. If they knock on the door at all, as a rule, they will wait until you come out to them. A person with heat in the liver is more likely to knock on the door even though they have arrived ahead of schedule. In extreme cases, they will not even wait for you to open the door before entering the room. Ito yung pagkaano mo hindi mo palang pinapaupo, nakapasok na agad o hindi mo pa pinapapasok. A more dependable auditory sign is the sound of their step in the hallway or waiting area. Yan. Pag may quick step po, can indicate heat and heavy step, excess condition. The sound of shuffling or dragging feet can indicate Yang deficient, Qi deficient, or damp phlegm condition. Other factors, though, such as the person being late or heavy winter boots, must also be taken into account. Other audible sign from the waiting area could be the sound of them repeatedly getting up and sitting down again or walking backward and forwards. This could again indicate heat agitating the sign. Ito mga hindi mapakali lakad ng lakad. Creating restlessness and impatience It could, though, also be due to pain and discomfort or nervousness. We must, as ever, place this small impression into a bigger picture before we can allot any significance to them. Another sound that have relevance in some patients is the need to rush to the toilet to urinate immediately on arrival. This, of course, does not have to mean anything. But some clients urinate both on arrival, before lying on the couch, and immediately after the treatment. This will tell you that they have frequent urination without you having to ask them. Malalaman na natin syempre kung ihi siya ng ihi. We can also hear the sound of the patient voice whilst they are sitting in the waiting area, if they are talking on the phone or speaking to their family members or other clients. Is the voice so loud and resonant that we can hear it through our doors? Is the voice so soft and quiet that we cannot really hear it? Even though there is only a curtain and short distance between us and them. Are they a person who immediately starts talking to complete stranger in the waiting area? Do they constantly make jokes and try to be funny? Do they start revealing very personal impression to people they don't know? O naalala po ninyo ito na discuss na natin ito sa mga unang topic natin, ano? Malalaman mo anong organ na yung may problem. The diagnostic significance of the voice itself was discussed earlier. What we hear can also reveal something of the relationship with other people. We may hear a lot of bickering or arguing, for example, something that could be an theological factor or something that we should at least consider when feeling their pulse, as this will have affected the pulse quality. So ito po yung ating summary para madali nating matandaan din. So pag narinig natin yung voice, pag loud voice po, excess pattern po yan, yung sigaw ng pasyente ninyo. Pag weak voice naman, tinatanong nyo, hindi nyo marinig, deficiency pattern. Reluctance to talk, pwede po siyang cold pattern or laryngeal deficiency. Excessive talking, yan, may mga hit pattern po yan, salita ng salita. Sudden loss of voice when hit. Pag gradual loss of voice naman ay laryngeal or yin deficiency. Kasi alam naman natin, yung lungs, yun yung responsible for our voice. Then yung 5 elements pa, no, ito yung mga makikita natin ano disharmony ng organ. Shouting voice, liver disharmony yan. Laughing voice, heart disharmony. Singing voice, spleen disharmony. Weepy voice, lung disharmony. Groaning voice, kidney disharmony. So, sa voice pa lang, alam na natin kung anong organ ang ating ititreat. Sa breathing naman po, so yun, talagang i-observe natin ano, pag yung paghinga niya ay coarse and loud, excess pattern po yan. Pag weak and thin, deficiency pattern. Pag umuubo naman sila, pag may loud and explosive, excess pattern. Pag weak, deficiency pattern po. Pag dry, lung yin deficiency. Sa vomiting, hiccup, borborygmus, and belching, so balikan natin uli. Pag loud sound, excess pattern. Pag low sound, deficiency pattern. So yung mga pattern po yan, nag-guide natin kung magtotonify tayo or mag-dispel. So breathing. In Chinese medicine, all sounds are produced principally by qi action. The process is not only directly related to the speech organ, but it is also closely related to the functional activities of the lungs, the heart, the kidney, and other organs. Normal sound reflects harmony of the viscera and sufficiency of qi and blood. When external pathogenic factor invade or the internal organ lose their harmony, a variety of abnormal sound may be produced because of the various type of evil qi and pathological changes. Hence, auscultation can not only detect abnormalities of the speech organ but also the pathological changes in the internal organs and the status of evil chi. Kasi malalaman nga natin kung excess condition ba yan o deficient. Yan. Diagnosis by auscultation includes listening for abnormalities in the voice, the respiratory sound, and the cough. Voice. The voice of healthy person may differ in volume, pitch, clarity, and sharpness because of differences in the body constitution and emotional state. They all have natural phonation, smooth tone, and clear articulation. Moreover, their speech is coherent. An abnormal voice shows absence of or changes in some of these qualities. So changes in the voice reflect the rise and fall of Jinwai Qi and are related to nature of disease causing factor. In general, a loud and clear voice in a person who is talkative and restless suggests an illness of exogenous heat strength. Ayun, yung mga init na galing sa labas. A soft and weak voice in a person who prefers to talk little or to remain silent suggests an illness or deficiency or of cold. A deep and muffled voice is a common exogenous when cold illnesses or blockades by internal accumulation of turgid dampness and is due to inability of lung qi to ascend properly or to nasal congestion. Pag may hoarseness naman po or loss of the voice, may be sudden or gradual. Sudden hoarseness or voice loss is mostly due to an exogenous evil attack the lungs and preventing qi from rising. So gradual hoarseness or loss is mostly due to internal injury caused by deficiency of the lung yin and kidney yin and consequent failure of the body fluids to flow upward. So sa mga pasyente pong may chronic illness na, pwede pong sudden hoarseness yung kanilang boses. Pero danger sign po ito. Danger sign of impending collapse of visceral qi. Pag incoherent naman po yung speech is mainly heard in abnormal state of the mind. Yan, hindi yung sinasabi niya kung ano-ano lang ano. It is chief categories of raving, muttering to oneself, delirium and stammering. Raving is rude, loud, and incoherent speech, punctuated by cursing and shouting. Ito yung mga nawawala na sa sarili. It occurs mainly in madness caused by plant fire disturbing the mind or fire trapped in the liver and gallbladder. Muttering to oneself typically consists of incomplete sentences, interruption, and repetition. It occurs mainly in psychosis, yung nagsasalita itong mag-isa, caused by deficiency of heart qi, so that the heart cannot nourish the spirit. Delirium and stammering both occur mainly when the patient is in the state of mental confusion. And the critical sign, delirious speech is senseless but loud and is accompanied by high fever and mental confusion. It is mainly due to strong heat, disturbing the heart and mind. Stammering in this context is weak and confused speech, punctuated by interruption and repetition. It occurs mainly in illness or deficiency in which heart qi is severely damaged, so that there is fragmenting the mind and spirit. Respiratory sound. Dalang govern qi and control respiration. Pag-aralan na po natin dati yan, ano? The kidney governs the acceptance of qi. Diba? Ibababa ng lungs, i-grasp ng qi. These two organs together regulate respiratory function, so that our abnormalities of respiration mainly reflect dysfunction of the lung and the kidney. The main respiratory abnormalities are dyspnea, wheezing, shortness of breath, and sighing. Kaya dito po sa mga respiratory zone, mahalaga nating nakikita lagi yung pagkakaugnay nito sa ibang organ para pag nag-acupuncture tayo, yung dalawang organ or yung tatlong organ involved, magkakasama natin ginagawa. So dyspnea is a rapid and labored respiration, often with a sense of urgency. In severe cases, there is gasping for air with open mouth. Yan, yung mga lumalaki-laki na yung ilong nila, no? Flaring nose and lifting of shoulders. And the patient refuses to lie down flat. Dyspnea may be of deficiency or strength type. In the strength type, dyspnea begin abruptly. The breathing is loud, coarse, and rapid, with a sense of relief upon exhalation. So pag nag-exhale na sila, yun, mas nakakaginhawa. The strength type of dyspnea is mainly caused by a strong exogenous pathogenic evil blocking the lungs or turbid phlegm impeding the lungs. In the deficiency type, dyspnea appears gradually and becomes chronic. Yan. The breathing is weak and slow, with a sense of relief upon inhalation. The deficiency type of dyspnea is mainly due to damage and depletion of lung qi and inability of the kidney to accept qi. Wheezing. So wheezing is a rapid respiration with whistle-like gurgling in the throat. Yan, ang tawag natin sa nito, yung parang may pusa. It has two main causes. One is the cold evil invading the lungs and activating dormant rheum. The other is phlegm heat accumulating in the lung so that lung qi cannot rise and qi and phlegm battle each other. Wheezing is often accompanied by dyspnea. If the patient breathes feeble and shallowly with a soft sound but appears natural, the patient is said to have shortness of breath. It is a sign that genuine qi is deficient and the body is weakened. Next is sighing. So often occurs when lung qi is stagnant or the patient is emotionally dissatisfied or depressed. Nagbubuntong hininga. The patient has a sensation of fullness and oppression in the chest, which can be momentarily relieved by taking the breath and letting it out. Yung parang nga, pag nagsaying na sila, parang masarap sa pakiramdam. Next is cough. Coughing is one main symptom of lung disease. The pathology of coughing is somewhat complex, but in any illness, cold, heat, and deficiency, strength can be differentiated by the sounds of the cough and the accompanying symptom. If the sound of cough is heavy and muffled and the sputum is white, the cough is mostly due to exogenous wind, cold. So that lung qi ascend abnormally and retrograde passion. If the sound is soft but clear, reflecting hesitant qi movement, the cough is mostly due to chronic deficiency of lung qi. So that its dispersion and diffusion function are impaired. If the sound is low with yellow and busy disputum, yung madikit, the cough is due to either wind heat attacking the lungs or massive accumulation of heat in the lungs. Yung parang pag tinuduro, nahirapang lumabas pa yan. A dry cough without sputum and a new illness is mostly caused by exogenous dryness injuring the lungs. Yung mga galing sa labas na dryness in it. A dry cough in a chronic illness is mostly caused by sustained deficiency of lung yin. So, internal na po, mahina na talaga yung yin. In an infant, sometimes there may be coughing that comes in fits. It's fit consisting of rapidly repeated coughing, and is like one long sustained cough followed by inhalation that resembles the whoop of a heron. This is whooping cough, also known as the 100-day cough. It is caused by turbid phlegm, impeding the air passage so that lung chi cannot move smoothly. Spasmodic cough resembling the bark of the dog is commonly heard in diphtheria. Yung wala parang ang haba-haba ng pag-ubo. Also known as white throat. It is due to a pestilential poison transmitting internally with fire attacking the throat. So yun po ang ating lecture. Thank you po. Marami tayong matutunan. Pero naalala ko, Doc, may share po ako dun sa ng heart. Kasi